Every time we see the post about depression on social media, we often see a lot of people commenting on it, both from those who suspect that they were suffering from depression or the people around them. Some people even speculate that they are suffering from depression using both right and wrong principles and use feeling to make judgments. There is also a questionnaire that allows you to analyze yourself until you are worried. So now let's look at the real factors that are the cause of depression. There are three main factors of depression. The first aspect is physical or biological factors, meaning there is an imbalance of chemical in the brain. Because when the mood is sad, will be very sad, unable to control their own emotion. It might make them feel so bad that they want to die. The next factor is the mental aspect, such as experiencing severe or prolonged stress until unable to adjust or have insufficient adaptation skill or have used inappropriate method before when there is a problem. It is difficult to cope with. And the last factor is a social factor, such as the loss of an important in person or close person, or having to live with people who cause stress all the time and unable to adjust to mesh.
The symptoms found in depressed patients are various, but these symptoms might not be noticed by other people. All patients will have negative emotion and can control their mind to be happy. Many of them will always think about death and suicide because they think the only way to stop all the problems they face is to disappear from this world. Their ability to work will change negatively. Their eating and sleeping habits will also change into negatively way too. They may eat and sleep much more or much less than usual.
Drug treatment use of antidepressant. Since the underlying cause of depression is release to the brain chemical mentioned above, it is important to give antidepressant to balance this chemical in the brain. Take the medicine until you feel better, and when it's better, you should continue taking the drug for another 6 to 12 months in order to prevent recurrence of symptoms. Even if you feel well, you must continue taking the prescribed medication to prevent recurrence. Since people who have experienced depression often relapse or may have relapsed, depression is considered a chronic disease that requires long-term medication. Mental healing. There are many types of mental healing methods in helping patients with depression, which may be talked to a psychiatrist, which will help patients to understand themselves, cause of self-sorrow, depression, understanding of the problem, and ultimately leading to a suitable solution. Methods that have been found to be effective in treating depression are cognitive and behavioral therapy. Believes that the pattern symptoms are caused by misconception because many times some people suffer because of their own thoughts, such as look at yourself in a negative light, seeing things in a negative, exaggerating. Therefore, treatment aim to modify the pattern concept to be more consistent with reality, including behavioral adjustment, use new, more appropriate skill to solve problems. In-depth psychotherapy to help patients understand the conflict in their own mind leading to depression.
Next is the graph of depression patient calculated by age. The graph below shows us the average age of people with depression that have two ranges. The first period is 20 to 29 years old. Second period is 30 to 39 years old. And in 2001, there are the most patients in this age range. By the age of 20 to 29 years old, there was an average patient in this year of 1,454 patients with depression per population. The second period is the age range 30 to 39 years old, had the average of 1,187 patients with depression per population, which if compared to the present, it considered that people with depression at this age is decreasing. Next is the graph of average suicide rate calculated by 100,000 people from 1997 to 2019, in which the graph is separate by males and females. So if that male have a higher suicide rate than women, although women have more prone to depression than men. The male suicide rate was the highest in the year 1999, was approximately 13.32%, with females having the highest suicide rate in the same years at approximately 3.91%.
Depression is the one of the most important and worrisome health problem. Today that often has a new about suicide problem, including the problem of physical harm to yourself or those people around you, which this event quite tragic. Mental health hotline and a list of hospital where psychiatrists treat depression. It is essential information that everyone must have because it can remain and pass it on those around you who are stressed or at the risk of depression. In order to get right treatment, such as Department of Mental Health Hotline 1323, Depressed We Care of Police Hospital 0819320000 and Samaritan Association of Thailand 0271367793.